Welcome to the 60 Plus Podcast.
I'm Janet.
I'm Joe. How are you, Janet?
I'm very well, thank you.
Oh, I love when you say I'm well. So
It's
much
gonna
better.
be a good day.
It is going to be a good day. Well, I'm going to tell a secret.
What?
I messed up the start of the
No,
podcast.
you don't need to tell that
well, no,
secret.
I do.
All right. Well, your secret was safe with me, Joe.
The first time we started, you said you had a pain in your foot.
I do have a pain in my foot.
And-
Yes.
And what's wrong with your foot?
Well, I sprained it and
Okay.
I've been in recovery and I've also been in physical therapy for it. And let me tell you, it's really helping.
Well, I had physical therapy treatments in the past several months,
Mm-hmm.
and it also helped very much.
Yeah. So today we're going to talk about physical
We
therapy.
are.
And we have a guest speaker.
Janet doing her Oprah imitation.
And you get a car and you
and you get a rubber band to do your stretches with. We have Keith Lindsay from Physical Therapy North.
Yes.
Welcome, Keith.
Oh, thanks for having me.
You're more than welcome. Thanks for coming in. Why don't you tell us a little bit about yourself?
Sure. My name's Keith Lindsay. I'm the Physical Therapy Director at Physical Therapy North here in Newburyport. We've got 4 offices, Newburyport, Peabody, Gloucester, and Beverly. I've been practicing for 30 years, orthopedics, sports medicine. So basically back, neck, ankles, knees, hips, you name it, we've probably come across it. Rehabilitation for children from 5 or 6 to people up to 98 or 100. I've seen it at the outpatient clinic.
Wow.
Oh, that's great.
Wow. Yeah, we were looking at age and like how many people in our age group. 60% of those 55 or more have had physical therapy
Of
or
some sort.
of some sort. Yeah.
That's impressive. It seems when I was younger, you didn't really hear much about people in physical therapy as often as I do now. Maybe I'm just traveling in a different cohort, but
Well, I think we've done a better job of marketing ourselves
Mhm.
to the public as far as getting people back to their activity levels faster, quicker, and avoiding re-injury. So it really started to take off in the 70s and 80s when there was the exercise boom,
Mhm.
aerobics, jogging, running, Boston Marathon, really popular. So a lot of everyday people just started running. So we started to see running injuries, and then a few therapists were involved with athletic teams and eventually pro sports teams. And so that put us also on the forefront, like he's in physical therapy. So that let other people start to ask, like, well, could I get physical therapy?
Right.
And that really helped blossom, especially in the orthopedic realm, as far as rehabilitating patients. In addition to that, currently we are seeing a large number of people that are remaining active in that 60 plus range
Right.
that we're seeing that are having total joint replacements, wear and tear on body parts. So we're helping them get back to their hiking, pickleball, playing with their grandchildren, and the activities levels that they seek.
Mm-hmm.
we had someone who owns, Megan came in, who owns Motivate Bar Studio. And
Megan Kinsey. Yep.
she said, I think there's a sale on hips going around because everyone seems to be having their hips done.
So interestingly enough, the hip replacements, the people who make them, the actual components themselves, Zimmer, Stryker, are the companies. The components have gotten so good, they really don't do physical therapy afterwards.
Okay.
So they'll see their surgeon, have the surgery performed, and then they'll gradually just resume their normal lifestyle over, 8 to 12 weeks. There used to be a precautionary period with the older hips that we would avoid certain motions to prevent any type of dislocations and things like that.
Mhm.
But the components and the surgeons have gotten so much better that they really just get back to what they're doing. And we rarely see them in physical therapy.
That's really good to know, just in case we ever
It
have to have
really
our
is.
hips replaced.
I have a good friend who had hip surgery last year. And 3 weeks to the day of her surgery, we were in Boston and we walked 3 miles that day. We got back home and she complained about the blisters on her feet, not,
Not the hips?
not her hips at all, which I was just amazed.
That's impressive.
It
Yeah.
really was.
Knees are a little bit tougher though, right? Is that
Much
right?
tougher, I think.
They are. So as far as the rehabilitation goes, because it's the range of motion that we're working on. The hips, we're trying to limit it originally and just gradually let them go back.
Mhm.
Whereas the knees, we need to push the range of motion to get them. Their full extension is the most important thing, because functionally, if it's not fully extended, it's shorter,
Yeah.
so they don't get that full extension. So we usually can get them back 8 to 12 weeks is what we shoot for,
Mhm.
to have their full range of motion, be able to go up and downstairs, carrying laundry up and downstairs or bundles,
Mhm.
things like that that people want to get back to. And then they we strongly advise that they continue with a home exercise program
Right.
after that.
Yeah.
But the surgery that's as well have gotten much better. They're using computer aided procedures where they have precise cutting and things like that. So the components fit more snugly. They're coming in with, having done this for 30 years, there's much less swelling, much less pain, that the patients do much better early on, which allows us to exercise them earlier, which only helps them get moving and loosening up further. So,
Right. I'm not sure I'd want to get right back to laundry, but yeah, I get your point.
Speaking of knees, before we started recording, you told us something about meniscus tears,
sure.
which I was very surprised about.
So when we talk to people who come into the office in their 50s and 60s, a lot of people now with imaging available, they're like, I think I need an MRI. Well, it's sort of a double-edged sword because you'll ask for it and then sometimes you'll find things that may have been existing there for some time. So roughly 52% of people over 50 will have meniscus tears that we can find on an MRI asymptomatic.
Mhm.
So they have taking normal knees, MRI them, will find meniscus tears more than half the time. So once you're another decade into the 60 plus range, it's probably even a higher percentage. So
Right.
that may not be the cause of their pain. And 6 to 8 weeks of physical therapy often will give you the same results of having an arthroscopy done and then resuming it. Plus, we're keeping the cushion absorbing meniscus in the knee with the physical therapy as opposed to just snipping it out and removing it. So long term, we feel that that's a little bit better outcome for them rather than, pull the trigger quickly and say, I need this scoped. I've got a meniscus tear. And again, it may resolve on its own with physical therapy and no surgical intervention.
Does
Yeah.
that just mean knees weren't meant to do what we do with them?
Well,
Over time,
I
right?
think as I tell patients, when they start to cutting back their activities because of knee symptoms, like what should I do? The PT's helping, but it's not quite there yet. And I said, well, nobody's ever had significant health risks with knee pain and knee arthritis. But if you don't do your cardiovascular exercise and your heart starts to suffer and you put on weight, you're probably better off. Let's fix these knees and get you going. So
Right.
we're just trying to get people moving. And I think people are moving later in life. And that's really what we're trying to promote. A lot of it is what you've done in your youth and genetics.
Right.
Genetics plays a role in everything as far as your health
So
goes.
what are some typical conditions you're seeing for our age group?
So osteoarthritis in the knees and the hips,
Mhm.
rotator cuff tears, and in the spine, it's regular degeneration of the spine. The disc height decreases. You start to get arthritic changes, stenosis of the foramina where the nerves exit. These are all normal findings. So people will get their MRI results. Now we have access to patient portals and things like that. So you can get your MRI results
Right.
and you read them and you're like, oh my goodness, look what's wrong with my spine or my knee. Well, a lot of that is what normally would be taking place in a 65-year-old body. So these are normal findings. And then it's best to have those reviewed by the physician that you're seeing to look at the films and go over them with you and be like, this is normal wear and tear. This is not consistent with what you're telling me clinically. So I always tell the patient, we treat the patient, not the film or the x-ray.
Okay.
So what you're telling me is more important than what we're seeing on a film or a scan.
Okay. That's good to know. Yeah.
Orthopedically speaking, of course.
Well, in preparing for this episode, I did a little research, not very much. I saw that more than a third of people age 65 or over fall each year. And a significant portion, maybe 20, 30% of those people suffer a severe injury. What are you seeing in your practice with respect to falls, and what can people do about it?
The last question is the most important. What can we do about it? So fall prevention is key. So when I talk
I
to
never felt older than when I went to the doctor, and for the first time he said, have you fallen?
Right.
It seemed to me like a older, I'm making air quotes, older person question to be asked.
Well, it's a point of focus because Medicare's seen so many claims that have come in for fractured hips, fractured wrists, head trauma, status post fall. So we want to nip that in the bud and do balance testing as far as getting people more active, getting them stronger, working on their balance. Exercises and programs such as Tai Chi and yoga have been shown to really benefit people as far as improving their balance. It's something that it's best to start in your as early as you can, but definitely in your 50s and 60s. Start these activities, train your balance so that going into your 70s and 80s, you've got good strength, you've got adequate range of motion, and you've got body skills to prevent falling. It is significant, and it's often associated with other more severe injuries that unfortunately can really impact a patient's quality of life.
What do you recommend your patients do to strengthen that kind of balance?
So avid walkers do really well. So we always promote walking, not only on a treadmill, but outside, because there you come across uneven grades, uneven ground, things like that. And just challenge yourself. Single leg stance, balancing on one foot, balancing on
Make
one
sure
foot.
there's something to hold on to, though.
Close. Or I often, if there's somebody who has a slight balance impairment for whatever reason, I'll have them do it just standing at the edge of their bed. And if they feel any fear of falling, just sit right back down on the bed.
Mm-hmm.
So yeah, great point. So we do advocate for balance training, standing with your feet tandem in a row, one foot behind the other, left over right, and then right over left.
Sounds like a sobriety test.
It sort of is, which they actually do assess your balance.
Right.
It's obviously impaired for different reasons.
Not that I would know.
Well, that's fortunate. But we do work on that, and it is key. So I said the Tai Chi is, people who've done that do really show
Right.
an improved balance.
Yeah, yoga too. I mean, I've been doing yoga for
Yep.
years, and I feel like my balance is really good
And it's
because
core
of that.
control,
Yeah.
right? You
Mhm.
body awareness and body control in all of these various positions
Right.
will help prevent that.
One of the other things I came across was bone density concerns for people. You talked about stenosis, and that has something to do with probably the wrong end of density. It's getting denser with the nerves exit. What can you do about that with physical therapy?
So with osteoporosis and osteopenia, there's
I'm sorry, osteopenia.
before osteoporosis is it's just showing that you're starting to lose a little bit of calcium, a little bit of bone
Okay.
mass. There's tests that you can have done. You could talk to your primary care about that. It's a pretty simple scan, and they'll monitor you if they start to see osteopenia setting in before it becomes osteoporosis.
Mm-hmm.
Weight bearing exercises. So we encourage people to go to the gym and use weight machines, which are easy. They control the motion for you. There's low risk of getting hurt on those versus free weights, and doing as heavy resistance as you can to get somewhere between 8 to 12 reps.
Right.
And that pressure through the bones will stimulate bone growth or slow the absorption of calcium. So stressing bones will help heal them and strengthen them. So in the old days, you would fracture your leg, they'd put you in a plaster cast and say, don't put any weight on it. Now you see a lot of people in walking boots, and we
Mhm.
want them actually to start weight bearing. That weight bearing will actually promote healing, and it also works with preventing osteoporosis. Weight bearing, weight resistance training is healthy for that. Even just squatting 20
Mhm.
times. Some people come into the office and 8 reps of squats over a chair and they're fatigued. Again, for safety, we do it in front of a chair. So if they lose their balance, they sit right back down. But to build that up, some patients get to the point where they want to put their a backpack on their back, and they put 20 pounds in there,
Right.
and they do it that way. So whatever it takes to add resistance to help bone growth, that's what we promote.
I was aware of the recommendation that you do strength training for muscle, maintain and build muscle mass, but I didn't realize that it affected bone density.
Absolutely.
Oh,
Yep.
that's fascinating.
We're learning so much.
We are. This is good.
Mhm.
I'm learning what I should be doing.
Right. That's just a matter of whether you do it or not, Joe.
Well, longtime listeners will know that Janet and I met a couple years ago playing pickleball. Now, we talked a little bit about pickleball before we started recording.
And neither of us are playing right now.
No, neither one of us are playing right now. Not well. We each had different injuries, but mine was not pickleball related. I don't think. What are your thoughts on pickleball?
It's a great sport, and it is the natural step down from when people just can't run and play tennis. They even doubles, they'll get onto a pickleball court. It's the camaraderie of your
Yes.
players
yes.
that everybody comes to me and says, I'm missing pickleball, but
Right.
I'm missing my friends at pickleball more than anything.
Right.
So social is very important, and we're looking to promote that. So we do see a lot of injuries resulting from pickleball, a lot of times because people haven't been exercising and their friends are doing it, and all of a sudden they pick it up without any training beforehand. There's no preseason. They just start playing.
Right.
So if they start playing in the spring, they haven't really done anything all winter. So they haven't really worked on their flexibility, and then they just go out and start playing. So we advise, if they're not active year round, to at least get into a walking regimen, practice your lateral movement, practice using your arms where you're swinging, contacting the ball and things like that. But it's also a sport where we can get back. I have a patient who had a rotator cuff repair, a total knee replacement, and an ankle fracture that required an open reduction internal fixation. That's plates and screws. And she's back playing pickleball very competitively.
Wow.
So it's one of those sports that you can get back to. Like after a total knee replacement, we really don't advocate going out and running marathons.
Right.
But doubles tennis or pickleball, skiing, you can get back to skiing on blues and greens, things like that. So it's modified, but you certainly can get back to that activity, and the camaraderie of your colleagues is
Right. Yeah.
so important.
Yeah. We've been playing with the same people for years now. And yeah, we miss them.
I do.
They're getting better. So you guys got to get back.
You've mentioned walking a few times. I'm a big walker, not on a treadmill. I just find that dreadfully boring. Outside all year long, on the beach, on a trail, wherever. I try and walk as much as I can. Some days it's, I hit my goal. Other days I don't. I read some time ago that the 10,000 steps that we're all familiar with was kind of just a marketing scheme of some pedometer company. I'm not saying 10,000 steps isn't a goal to attain, but what is a good goal to attain?
I don't focus really on the steps for patients. I just try to tell people, if you can get out 5 days a week, take a day off here and there, but certainly get out, be active for at least 20 to 30 minutes. Huffing and puffing walking. People will come in. Right. People will come in and they'll be like, "Hi, I walk around the office all day," or "I'm walking around the plant." And I'm like, you're on your feet all day, but it's not sustained and it's not aerobic and it's not aggressive enough, to be honest with you.
Yeah.
So it's got to be at that huffing, puffing pace where you can have a conversation, but you're working, and it's got to be, 25 to 30 minutes straight and 5 days a week, and just get moving with that. I think the number of steps was a great idea if you're selling a Fitbit and it measures those. So I think that's where that came from, but really it's just the duration. And if you can walk further and longer, if you have the time to do it, people will be just like, "Oh, I just can't find the time." I'm like, well, I said, if you could, a half hour a day for your health is, because you want those later years to be really, really good. When you finally retire and have fun, you want to have fun.
Right.
So, but even after spinal surgeries, the first 6 to 8 weeks, we really don't have them come to PT. We just say, go out and walk and build it up to, 45 minutes to an hour. And, for any spine injury, no more than 1 day in bed for bed rest. After that, get up and start walking. You start to actually tighten up, lose strength, and they actually regress. So anybody who spends 2 to 3 days in bed with back pain generally takes longer to recover than somebody who's in 1 day. And even if they're just up walking around 10, 15 steps every hour, the motion will just help with the pain and pain reduction. And along those lines with back pain, the better aerobic shape that you are in, the less frequent you will have back pain, and the quicker you recover when it does occur.
The philosophy of that has changed so much over the years. When I was a kid, my dad had back surgery, and I remember him being in bed for a long time. Not just a couple of days. It was, I think, a couple of weeks.
The surgeries back then, I guess when you look back on things, the current surgeons would be like, it was barbaric, right? We would go in there and just shave off the muscles off the spine to open up to the bone, and then do the laminectomy and take things out. And then along the way, they started using scopes, and they said, well, we can do a microdiscectomy, and they go in with a couple little portals and take care of things. So it's much less invasive. So all those muscles are not disturbed, so they can get up and start walking more immediately, where back then you would have to wait the 6 to 8 weeks for that tissue healing to take place.
So I'm a big dancer.
Oh, great.
Do you see any dance injuries?
More so ballet or salsa or tango or
salsa, hip hop, Latin.
Great.
Yeah.
And that's a great form of exercise. My mom does a lot of dancing. She has 2 knee replacements, and she grew up in the late 50s, early 60s, and she's still down in Pennsylvania, and she goes out 2 nights a week and mashed potatoes, jitterbugs, and calypso.
Swing dance is a lot of fun.
So it's great. It's a great form of exercise. Dancers that we typically see are usually in their teen years, tap, jazz, lyrical, things like that. So they're training pretty heavily. One of my clinical instructors when I was in grad school toured with a ballet group out of New York City, and ballet dancers especially. It has a lot to do with the training, but also their diet isn't great. So
Right.
we see this triad of not eating enough, so they lose strength. We see patients now, the GLP-1 drugs have been great in weight reduction for people, but
Hmm.
unfortunately they lose tremendous amounts of muscle as well.
Okay.
So when you see them, they come into the clinic and I've lost 120 pounds. It's great, but their legs are spindly
Yeah.
and they're having instability. So they've lost a lot of strength. So the muscle mass loss, they're working on that to try to figure out how we can get this so they don't lose as much muscle, because we normally naturally lose muscle strength as we age.
Right.
Nobody is as strong in their 60s and 70s as they were in their 30s and 40s. And just unfortunately decreases with time. So anything you could do to maintain that or slow the process is helpful, especially we talked about fall prevention and things like that.
Right.
So if you do fall, you can stabilize yourself and catch yourself.
You mentioned getting to the gym and doing the strength training with the weight machines. I remember when I was younger, it was all about, pushing yourself harder and harder and harder. That's really not the way to go anymore, is it?
Well, if you're looking to become a professional athlete or maximize your
Well, when you're 60 plus.
Of course, at that age group, no. Look, if we can get somebody into the gym and they can do 2 to 3 sets of a weight where anywhere between 8 to 12 reps, they're reaching fatigue,
Hmm.
and they're like, okay, I can't really do one more rep. That's phenomenal. And if they can do multiple body parts in one day, I mean, personally, I'm only in my 50s and I go to the gym and I could do a full body workout in about 35 minutes, 2 to 3 times a week, 1 or 2 sets with weights to that momentary muscular fatigue where you fatigue. And that's sort of where I stop. Now, there's a number of great trainers in the area, personal trainers that we have a lot of patients that'll be like, I'm finishing up PT and you know what? I've lost weight. I feel better than I did when I started this. How can I keep this process up? So we let them go out, find their trainer, whoever they want, let them call us. We'll discuss with the trainer. If this person had a rotator cuff tear, so they're 8 months out. So this is what you still want to be wary of. And they're very knowledgeable. So all throughout the area of Newburyport, Newbury, we do utilize a lot of trainers that we speak with.
I know we realize the benefits of PT, right? I mean, there's so many. I know that I'm a big supporter of it now that I've been in it. But what do we do to prevent?
Well, I think for prevention, for people that are listening and aren't very active, the first step is the hardest step, just to get out there and start with the walking that I've already preached about quite a bit. Get into a walking program, find friends that do it, and then maybe branch out and do pickleball, things like that. I think where there's a community in any activity, there's a better compliance with attending, right?
Mhm.
You'll show up because you know your friends are going to be there.
Right.
Motion is lotion, as a lot of the therapists like to say. It's great
Mhm.
for the joints. It's just movement. And if it's as simple as walking around your block and maybe just doing a little bit of stretching, just start gently with that and just get moving. So I think most of the people that are active do a pretty good job of staying active, but we really try to reach out to the patients that come in and it's their first time in physical therapy. They really weren't active all of their life, but we really want to just promote a change in lifestyle.
Mhm.
It's very rewarding because you do see people that were like, this really changed who I am. And
Right.
that's
Yeah.
just great when you can really reach somebody like that. In addition to getting them better, but then you really change who they are and they come back like for something else like 5 years later and they look great and they're like, I am doing pickleball now and I play baseball with my grandkids and it's nice to see.
That's
And,
great.
if you get out and you walk your block, it's not too long before you say, oh, I'm going to do a second lap. I'm going to go around twice. And then you might find a friend to go on a walk with, and you find you're walking around the block 3 times.
Mm.
It doesn't take too long.
No, it doesn't. And it's a great mood lifter. There was a study I read about where they had older adults with depression, and they half got Prozac and half were given a walking program, and they scored similarly
Right.
8 to 12 weeks later that the exercise was just enough to make them feel better.
Mhm.
And as you said, it just promotes you feel good. So you walk a little bit further. And that is just what we're looking to do and just really get everybody active and moving and healthier.
Yep.
All right.
Absolutely.
Keith Lindsay from Physical Therapy North, thanks for coming in. This has been really informative. I learned a lot.
Yeah, it's been great.
Yeah, really, really appreciate your time, and thanks so much.
All
Pleasure.
right, that's it for this episode of the 60 Plus Podcast. I'm Joe.
I'm Janet. Bye.